we welcome each of you to this conversation. I especially want to thank our panelists for generously giving us their time and their insights today. We're very excited about having these gentlemen with us. I would like first to introduce to my right Dr. Brad Hesse. Brad is the Chief of Health Communication Informatics Research at NCI. He is a social psychologist and is very widely published. If you happen to see his resume, it's many, many, many pages long of important publications. He's published particularly in health communication, informatics research, and human systems integration. His contributions in these fields are many, including serving on the board of the American Psychological Association's online resource PsycInfo, and he serves as director of the Biennial Health Information National Trends Survey. I'm proud to note, by the way, that as I was understanding his background, to see that one time many moons ago, earlier in his career, Brad worked for AIR in California. Of his many impressive credentials, most impressive is his drive to bring the power of health informatics to eliminate the death and suffering of cancer. Kevin O'Connor, to Brad's right, is president and CEO of User Insight, and he brings two highly valuable assets to today's discussion. The first is strategic focus on users and user behavior, and the second is a relentless drive for innovation. Kevin is a leader to help in helping Fortune 500s, national nonprofits, and government create intuitive products and maximize the consumer experience. His firm has conducted user-focused research, digital strategy, and design for over 300 clients, including GE, Verizon, CVS Caremark, and the CDC. As Kevin so succinctly and so often says, we help clients focus on, help clients make products that people want to actually use. To his right is Daniel Davenport. Daniel is executive director of the digital agency Think Inc. Constantly tracking and often leading trends, Daniel is fascinated by the ongoing rapid evolution of our digital world and enthusiastically embraces new developments in platforms, devices, and content types. But more than that, he's a master of optimizing emerging technologies for achieving actual goals. Daniel drives digital strategy for clients ranging from Coca-Cola and Orkin to Kroger and the CDC. We welcome Daniel's quick, creative mind to the panel. And last is a face that may be very familiar to people in the audience, is Roy Dayani. Roy represents Google and serves public health clients, public sector clients, many of them within HHS. His efforts focus on social media marketing and paid digital media strategy. In his 6 years at Google, Roy has had a front seat on some of the most exciting changes, developments in digital communication. I'm sure we would all agree. And Roy works on two sides of the digital reality. Just as he works with the thought leaders at Google in California, he then travels east and works with folks in government to really uncover the practical applications of those innovations. So welcome, panel, and thank you all so much for joining us today. And now it's my pleasure to introduce Dr. Galen Cole. Galen is, I think, known also to some of you, if not many of you in the audience. I'm happy to say that Galen joined AIR after 23 years at the CDC, where he has served as a research psychologist, health communication scientist, and national thought leader in public health communication. For 5 years prior to joining AIR, Galen served as the senior health communication scientist at the CDC's Division of Cancer Prevention and Control. He's a licensed counselor and psychotherapist as well as an author, and is committed to strengthening the mental health system in the United States. He brings both sides of his experience, behavioral science, health behavior, and communication to today's conversation. Galen is going to frame today's panel, and could I welcome you to the podium, Galen? Thank you.
Hello and welcome, everyone. As Julia said, my role today, as I understand it, is to set up and contextualize and frame what promises to be a very interesting conversation among some very intelligent thought leaders. And hopefully this conversation can continue. I've got this slide up here so that folks who may be listening in can follow us on Twitter at health_AIR, and the hashtag is healthBCDE. BCDE is our acronym for behavior change in a digital environment. As I've watched Dr. Tom Frieden, the head of CDC, fight the communication battle around Ebola, it's brought back a number of memories, some very scary times. I met Julia shortly after 9/11 when we were trying to respond to anthrax and any number of things that were coming at us. And I think the most difficult thing that we ever did at CDC was communicate. But I was reminded, and I've often said, that health communication is the voice of public health. And if you think about it, it's the voice that alerts us to new scientific findings. It's the voice that helps us understand how to prevent certain diseases, reduce our risks, how to navigate the healthcare system. And above all, it's the voice of cure. If I've learned anything about communication, it's very difficult. My experience in developing and evaluating large campaigns taken together with my clinical experience, which often involves sitting across from couples who always, when you look at the intake paperwork, say the presenting problem is communication. No matter what the presenting problem is, it's communication. And as I've sat across from individuals, and as I've tried to persuade in large-scale ways, I've come to the conclusion that communication is arguably the most difficult thing that humans try to do. Unfortunately, many people tend to think it's easy, and when they think it's easy, they always get it wrong. So when I was hired to take over as Chief of Research and Evaluation, responsible for evaluating America response to AIDS in the early 90s, we found that communication was much more difficult than it needed to be because of a number of, I'll call them system barriers. And I felt like, as is depicted here, I was a cook in the kitchen working in a very large restaurant, and patrons were coming in the door. And we would talk among ourselves. When the patrons sat down, we would look at them, and depending on what we picked up and some random criteria, we would decide to cook up some food, and we would serve it to them. And a lot of times we got that very wrong. In fact, that same analogy could be applied to a number of our early PSAs. One that I always use as an example is the banana PSA. There was a man demonstrating how to put a condom on a banana. And this was cleared at the highest levels. And so it went out there, and our target audience was very confused about what we were trying to do. And an unintended effect was the banana industry started calling. They were very upset. But we had set this precedent, and condoms were being put on bananas all over the world. So we got a lot of feedback about that and other PSAs, and obviously what we were doing wasn't working. So a number of barriers were removed, and we were given the opportunity to use a lot of private sector techniques to communicate better. And one of those was to actually talk to audiences before we developed and executed campaigns. And in the process of doing that, I felt like finally we have servers in our restaurant. We can send people out to the tables and ask folks what they want to eat and how they want it served and in what order. And we got it much better. You know that even though we have servers in restaurants, a lot of times they don't get it right. So the point is, it's important that we continue to do communication research. And the reason I'm kind of trying to tee this up in the way that I am is a lot of us are kind of coming along when it comes to embracing the digital world. I got my PhD in 1982, and I didn't have a laptop, and there were a lot of things missing back then that I could have used to communicate better. So I know some of you might be in that audience, and so I'm challenging our panel to kind of think about some of us that didn't grow up in the digital world. As I said, research improves communication. It helps us get the right message to the right people at the right time, and when they get the message, it's familiar. It's coming from the kind of spokesperson that they want to hear from, and it resonates, and it's credible. So research is very important. Unfortunately, many public sector groups that are trying to do communication are still kind of hobbled in this regard because of OMB. I recently tried to evaluate a campaign that we spent $22 million on. When I left CDC, we still didn't have OMB clearance in it. We're 8 months into it. So it's important that we still kind of bring down some of those barriers. So new recommendations, especially speaking to Brad because he's still in the federal government, we'd love to hear recommendations about how to overcome barriers to effective communication. Another kind of advancement, not kind of, a real advancement in communication in the early days was we brought behavioral scientists in. I remember a sign at CDC headquarters. Somebody had gone outside of what was politically correct and put a sign up and said, "We are behavioral scientists, we are here, get used to it." I thought, that's a very telling message. And when I left CDC, there were hundreds of behavioral scientists. And what they helped us do is sort out, explicate, and make sense of a number of independent variables that we have some control over when we're putting together the communication that's going to run down whatever channel it is, in this case, digital channels. So what we learned was incredible, and I've used this slide I don't know how many times to explain to my leaders that communication is not just sending a message. The evidence shows that people have to receive the message, pay attention to it, comprehend it, believe it, remember it, have skills to act, have few environmental constraints to acting like you want them to act, believe that the action you're recommending outweighs, the advantages outweigh the disadvantages, perceive that there's social support for the action shouldn't conflict with their personal standards, they should receive reinforcement, and they need self-efficacy or the confidence that they can do what you're asking them to do. A lot of times we used to blame the public and our target audiences for not changing. After behavioral scientists came to town, they taught us that, wait, we have an obligation to manipulate variables in a way that makes the likelihood that people will understand and be persuaded go up. So I remember a very scary couple of weeks when I was in the HIV center. We got somebody from Washington said, "We gave you $44 million for this campaign. What effect have you had on your audiences?" And that was tough. Finally, we were able to put some data together that showed, because in some of our surveys we'd collected data on behavioral intention. Early on, the goal was to just get knowledge to the people. Remember, if you're old enough to remember, someone said we should send a brochure to every adult in America. And so the basic assumption there was that if you give people information, they'll act. That soon changed, and we began to be held accountable. And that kind of brings us to what we're talking about today. As we got more money and made bigger investments and evaluations, we were able to get pretty good at figuring out whether exposure to messages, the dose response, was actually working in the favor of reducing health problems. So, and then along came this thing called digital, and I remember being warned against using the internet. We will never use the internet. We will never have computers on everyone's desks. Bill Gates is crazy. Well, not so much. So we being people who, by this time, I was becoming more senior and had some leadership positions and was calling the shots on how we were going about this. And I was very familiar with how you talk at people, but not so familiar with how you talk with people. And that really is kind of what this is about. We've experienced over the past several years this dynamic transition from broadcast media monologues to social media dialogues. And so that brings me to our infograph today, our first one. And you can see that, I don't know if we're old timers or not, but we've learned a lot over time as we've done public communication, and as we've tried to persuade and help people prevent disease and control disease. We've learned that we can control certain variables to create a communication mix that's tailored to people in a way that it will increase the likelihood of influence. We've learned about these new channels, and as we were putting this infographic together, we know what we want to know. But there is this black box, and we want to know this over and over again in an iterative way. And we think we know what's in the black box, being as confident as I am sometimes. But someone on our team said, hey, before we go forward with our ideas and make these investments, we should invite some really, and I'm quoting, some really smart nerds to talk to us about our ideas so that we make sure that we're on the right path. So none of these gentlemen are nerds. All of them are very smart. And we want to hear from them. We've learned about the clicks and the likes. We want to go beyond the clicks and the likes. We want to know whether exposure to digital messages actually works, actually causes online and offline changes. We want to know, if we don't know how to do that yet, how are we going to find out? And one of the big things, Kevin just shared this with me, this infograph, that I think is really important to us. As a clinician, I'm all about HIPAA forms and keeping information private. But I have this portable band on my wrist, and I upload the information about how much I run and walk and bike, and I know somebody's using that to sell me things because they're getting better and better at guessing when I go online what I want to buy. So I want to know, and Julia will ask pointed questions about this, what about privacy issues? If we get really good at this, is it important that we preserve privacy, or is that something that's a thing of the past? So again, here's our Twitter read, and I'll turn the time over to Julia and the panel.
Thank you so much, Galen. So we're going to have a discussion up here rather than straight Q&A. And at 1 o'clock, we're going to ask you all to join the conversation, to share your insights, make comments on things that you've heard, or ask questions. Okay, we'll be going until 1:30. So very briefly, before we get to the meat, I wanted to ask the panelists if they would do me a favor. So we've been having a discussion internally on our own team. For communicators, vocabulary is really important. And I'd like to ask you if you would very briefly define or differentiate between social media and digital media, because we'll be using both of those phrases and sometimes interchangeably. Let's at least put on the table that there might be a difference, and then people will say what they want. Does anyone want to take that?
Who's the first nerd that's going to speak?
I can be the first nerd. Thank you. Thank you, Julia. And thanks to AIR for organizing this and for for getting together this great groups of individuals. I'm honored to be part of this panel. That's a tough one to kick off with, because I think there's a lot of crossover and they aren't necessarily separate. When I think of social media, when I think of digital media, I think of anything that lives online, any form of communication, any way that a brand or an organization can connect with an audience using digital means. Part of that, I think, is social media. And with social, I'm really thinking about how can you really take advantage of the two-way nature of the internet to allow users to participate in the conversation, to add their thoughts, their insight, and to share it with their community.
Thank you.
I'd kind of echo that. And first of all, thank you very much. It's a pleasure to be here talking to you guys in Washington, D.C. today. I would echo that and say that, that the foundation, that digital is kind of a foundation way of talking about how things get communicated or data gets communicated back and forth. But it's people that are always, or not, no, that's not right anymore. For the most part, it's people talking back and forth to each other. So social and digital are gradually getting pushed closer together.
Yeah, and then I would say that technology is allowing people and technology to create a social environment by aggregating everything in the digital world. So everything that's being done is becoming a way of communicating a brand's message or some content or whatever the goal might be. So it may not just be people, right? It could be actions or behaviors, and those things are being propelled out to other people and in a way that we've never seen in history.
So do I get to play the old nerd on this?
Please, yes, absolutely.
By the way, I was going to show for what changed. I was going to look up the condom-covered banana. I thought, I better not do that. I can't imagine what it's going to look like. So, so the funny thing is that the roots of the internet go back to a fellow by the name of Doug Engelbart. He was one of the first fellows. He created the mouse. And this is back in the early 1960s. And the funny thing is when he and his team were developing this vision for TCP/IP, which had eventually become the ARPANET and the internet, he made it so that people could send data back and forth to each other. And they did that, and 2 minutes later, they sent messages. Hey, do you want to meet me at Zotz for lunch up in Palo Alto, understand? That was the birth of social media. What's happened is that we've moved on and we have all sorts of new words to capture the evolution of these channels. It's a digital medium that I think now is extending out to the Internet of Things. We can allude to that a little bit. A lot of those data packets are still going back and forth, and all that's done through digital ones and zeros. That's the overarching digital media, and this should be part of our conversation today. And then there's been an evolution of the way that people interact socially. So beginning with just email, which is still king, by the way, and then moving into chat rooms, discussion groups, the UNet back in the day, and now every possible flavor that you can imagine at Facebook and Twitter and that kind of thing. But that's the way I would, let's not get too hung up on words.
Yeah,
it's just this big movement in a digital area.
Well, thank you all very much, and I think that just helps clarify. So we may swing between phrases, but at least we have some common understanding, or shared understanding. So a few decades ago, several decades ago now, social marketing theory was created out of private sector marketing. Health communicators turned to the private sector to understand the theory and the practice of marketing and effectively reaching audiences. And today, what we are starting to do, I think as well as an industry, is to be turning to the private sector to ask, what do you have to teach us today about communication with audiences in this digital world? So my first question, and I have actually a couple of buckets of questions, and this first bucket is about the private sector. Looking to you to what we can learn. How well is the private sector doing as it seeks to uncover the linkages between digital communication and online behavior and digital communication and offline behavior? How's it going out there?
For me, I think the commercial sector, the private sector, however you want to refer to it, has made significant strides in the last 10 years in doing this by using technology to what I might call close the loop between what happens online and what then happens offline. So, a social media campaign is sent out there, or a Facebook campaign is sent out there, and a coupon or a QR code is put on there. Which, by the way, QR codes have never caught on as much as anybody thought they would. But the point is that you could take that campaign, share it to other people, see the influence, if you will, or the ripple effect, and then somebody could go into a store and at the point of sale could redeem it. And in that way, you can measure the ROI of that particular campaign. That's an easy way to measure it, right? Because there is a definite way, a definite behavior that you are trying to encourage or affect. The more difficult things to measure are, things like awareness. If you're creating digital campaigns or products, and these products are sent out there, and you are trying to build awareness for your brand for usage, how do you know that those things are actually driving loyalty, for example, or pulling in new customers if you don't have a mechanism to close the loop? So while I think that the commercial sector has made great strides in the last 10 to 12 years, I still think it's very much in its infant stage. And I think we're going to talk a little bit more today about things that are happening even over the last 18 months with location-based services that are allowing large organizations to aggregate huge amounts of data to see where all of us go on a regular basis, and now tie our movements in society to actual digital or social campaigns or initiatives.
Yeah, I completely agree. I think that we should acknowledge that the private sector is battling this as much as the public sector is. This is a really tough one. And for years, as time spent online has increased, and consumers, the first few kind of portions of the buying cycle actually happen on the internet, brands and organizations are trying to figure out how you can measure that and how you can bridge online and offline. So this is a problem that everyone's facing. Definitely, we did see for a few years that the whole idea of getting you to print a coupon or some kind of offer online and bring it into the store was a great way to measure, but most people don't really do that. I think that with mobile, that's going to change. Over the last 3 or 4 years, the time that Americans spent online has pretty much doubled, and that's all because of smartphone usage. It's pretty much all smartphone usage. So nowadays, if you think about it, wherever you go, you've got at least one tech device on you, right? You've got your smartphone. Many of you have, Dr. Cole's got his Fitbit around his wrist. Some people have Google Glass or other pieces of technology. You're connected wherever you go, and that's going to help to bridge what you do online at home or on your smartphone with now you're online when you're in the store as well. So I think it's going to be interesting to see how you can actually connect those, given that we're online all the time.
Yeah, the mobile capabilities are really going to help close the loop. I'm sure all of you have coupons in your Google Wallet right now, probably in your pocket. Yeah.
In your Google Wallet, please use those.
Google Wallet, yes. Google Wallet. Did I say Google? There's one thing that I've seen fairly closely is a company with a similar problem to tracking the offline outcomes is of course Coca-Cola. When I first started doing this in 1994, Coca-Cola's stance on the internet was more or less, so what? If nobody's buying their product, you can't pour a Coke out of a computer, I don't care. That has radically changed. You may have heard of a program called The Hub, which is a coordinated social monitoring effort it's a global footprint, but it's based out of Atlanta. And I think there's 23,000 mentions of a Coke product every minute, and they monitor all of those. So it's a constant stream of information. But one thing that I wanted to point out is that I just rolled off a project called Spark City, which is an internal global intranet for sharing information and best practices. And it's a lot of times we talk about external messages, but the fact that internal employees have become so used to the ease of use of things like Google and Gmail and things, and they expect their internal tools to be just as good, or else they won't use them. So you've got the opportunity to use digital and social media to talk outside to your constituents, but also to enable your employees internally to share information rapidly at a global scale.
I think one thing I'll add is, and I'd like to do an example of that Coke example, but years ago it was all about mass marketing, right? It was commercialization through commercials, and a great marketer once said, 50% of my budget makes me all my money. Problem is, I don't know which 50%. And so what's exciting, I think, is that we're getting into a time where we're starting to be able to not only measure the results of these campaigns, but leverage the results of these campaigns in future initiatives. So an example that in what Daniel was talking about is, let's say you're out riding in the park, and your phone, you're listening to your iTunes on your phone, and your phone knows that you've been riding now for 5 miles, and you're close to a Coke machine, and it pops up a little message and says, hey, half off your next bottle of Dasani water, click here to find a Coke machine. And so you click there, and sure enough, there's one right over there. So you walk over, and now you can make payments on your phone. You put it up to the machine drops out the water. We've closed the loop on redemption, but it gets better than that, right? Because the machine now talks in the Internet of Things, and the machine sends a message back to Coca-Cola and to Coca-Cola Enterprises and say, we now need a new water in this machine. Add that to the inventory. And then Coca-Cola says, we now just sold another water. Add that to revenue. And you have all these downstream things that start to happen by this technology that closes the loop.
And the next thing is going to be not the Dasani water, it's going to be Kevin's Dasani water, which is flavored with a little bit of lemon and a little bit of lime.
And a little bit of tequila.
And a little bit of tequila. I don't think they can do that in
You
this
can't do
machine.
that.
I don't think so. Maybe. I'm not sure. But yeah, mass personalization is definitely upon us.
So you've spoken about several of the things that are being done to encourage consumers to buy that product or adopt that behavior or that join that activity, sign up for that service. Are there any other really interesting things that are happening now that you haven't mentioned that before we move on? Any other interesting things in the private sector?
So Google looks at measurement in a framework of three points, and I think that it actually fits really well into the slide that we saw earlier, the framework, and that's see, think, do. So I'll unpack that a little bit. You first of all want to make sure that the audience is actually seeing your message, right? It was recently published that over 54% of digital ads are not seen because they're below the fold or they're hidden behind a player or somewhere. So over half of digital ad spending is wasted, right? And so a lot of media companies now are implementing these controls to ensure that you only count an impression if somebody actually sees your ad. I mean, it sounds kind of basic, but it's a big issue in the industry. Also, as more and more marketers are realizing that their target audience is spending time online, more and more so, and they have to move their focus online, they want a way to measure that, kind of the same way, I mean, Dr. Cullen talked about, the folks that are from the world of TV, how do you measure online? And so lots of companies like Nielsen's developed OCR, and other companies are developing similar tools that essentially let you verify that the audience that you're reaching online is who you're actually trying to reach. Is it males 18 to 34? Is it moms, etc.? So this whole idea of making sure that the money that you're spending and the resources you're dedicating to reaching a specific audience are actually all being spent in the right way. And the second piece is the think piece, right? So what are people thinking about? And I think this is really important because I don't think that we're going to find one sole mechanism for measuring ROI or behavior change or anything else. So Kevin talked about brand awareness. And many studies have been conducted that show that increases in brand awareness and affinity and recall and loyalty will correlate to increases of sales, right? So if someone likes your brand and they're aware of it, if someone's familiar with your laundry detergent, when they're walking down the supermarket aisle, they're much more likely to pay attention to your brand and potentially buy it as well. And so these are studies that you can do right now, many of which are available online and through Google, as through many other media companies, to see are people actually remembering the message that they saw, is the message sinking in, etc. And then the last piece, which I think we want to really focus on, is this do piece. So for the private sector, if you're selling a product, it's a little bit easier because you can just take a look at your revenue. Even before this cool technology of, can you put your phone up to the Coca-Cola machine, became available or becomes available, you could at the very least take a look at, your big media campaign that runs in November and expect a surge in pricing and in the sales in November, excuse me, right? And hopefully at least you'll see that correlation, which can help validate your overall strategy. With the government and behavior change, it's a little different because the government's not trying to sell a product, right? So I think the biggest thing that, at least from a digital perspective and from a Google perspective, the biggest tool that we have to understand that these campaigns are actually pushing and influencing behavior is taking a look at search data. So it's recognized that what you search on Google can be very indicative of what you're thinking or what you're doing, right? If you're searching on hotels in Barcelona, you're probably planning a trip. And if you're searching on flu shot at 20009, you're probably looking for a place where you can get the flu shot in DC, right? And so we generally know that what you're searching can be indicative of what you're thinking and what you're doing or what you're planning on doing. What we can do at Google now, what we've been doing for many of our public sector clients, is measuring the changes in search behavior after a media campaign. So for example, we worked with CDC on a smoking cessation campaign, encouraging smokers to quit smoking. And what we found was that people who saw their ad online were 60% more likely to then go search for something like help quit smoking on Google. That's pretty amazing, right? So you can actually say that compared to a control group of very similar users who didn't see that ad, seeing that ad alone increased their likelihood to search for more help by 60%. Right? And terms like quit smoking, help quitting smoking, the resources you need. Now, I can't tell you that those people actually quit, but I can certainly tell you that the campaign is pushing that behavior change in the right direction.
And Roy, how did you conduct that research to know what was really happening?
Yep, so that's a Google internal research study that we do, and essentially we have this, anonymized data looking at, what users are searching on, and so it's a very easy kind of experiment with control and test group. We take a look at folks who saw the ad. In this case, it was a smoking cessation banner, and we compare them to very similar users, same age, same gender, same geo, etc., who didn't see the ad, and then we monitor search activity over the next few days. And what you hope, what you expect to see, is that people who saw the banner will actually go on to conduct more searches, to seek out more information, to hopefully quit.
Interesting. Great. Well, the next bucket of questions, collection of questions, is about cross-fertilization between private sector and public sector. So let me first ask, and I think, Brad, you may know the most about this, although others do as well. Have the public and private sectors been working together at all to relate what's been being done in the business world and how it might be applied to help the public sector?
So the answer is yes. They have been working together, but it's an old partnership and a new partnership, as you can imagine. It's an old partnership with new players, I think, and what that means in this new world. In a world of participative media, in a world where it takes more than one mind to solve the problem, there's a creative tension that seems to occur sometimes in the private sector, and I'm from medicine, recognize. So we always got nervous about the whole snake oil thing, kind of got burned on that a little bit. But at the same time, we depend in medicine for the private sector to implement whatever the heck we can create to help save lives. So what does that mean for us? Well, we're in a very interesting place because we no longer have the ability to unpack the 3 billion plus base pairs and then create the technologies that will essentially do kind of personalized medicine that you were talking about, kind of in the bigger sphere. Whereas now that technology can be developed in the private sphere, and that's good news. What we can do is we can invest in the research that brings these things together, and I think that's important. So the kinds of things that we're talking about here, this notion of distributed processing of crowds, and what can that do for science, and then where does it cross a line, where do we back off, and where do we allow private sector to come in? So I think a lot of what we're going to be seeing in the years ahead is this tentative relationship that's got to proceed forward with a level of understanding to say, cool, we've exposed this entire supply chain. We can get it one piece, search piece, because what do you know, Google cares about search and they have that data. Let's exploit that data. And then we have other ways of getting other parts of the supply chain. What happens when they hit a distribution center, let's say going for inoculation or something? Can we pick that up from, and let's see if we can get the ecosystem built forward.
Very exciting.
So I've just got a quick example that I've seen recently that I think touches on that a little bit. There's a program now at Walmart to encourage healthy eating, and it's a joint project between a number of universities. I believe the CDC was involved with the efforts to prevent obesity, and then Walmart is working with a health insurance provider. And there's a little sticker on the food that's healthy, and you get a discount for buying it. But I think one thing that's also important to remember, especially in a communicator crowd, is that this program is all executed through their frequent customer card. So the underpinnings of the program are all digital, and so digital in this case is a tool through which people are being incentivized to eat better, do healthy, create healthy outcomes. So it seems like it's not a big message, it's not a search campaign, but the underpinnings of the program are digitally enabled. So it's not digital's very much a tool for doing things as well as a tool for communicating.
Well, I think that's what also makes all these wearable pieces of technology so successful, is because they're not just encouraging you along the way or helping you track one piece. They're really kind of helping you live a lifestyle that's healthier and customized to what you need, right? So if it can tell you, you walked 5 miles today, now here's what you should be eating to replenish your calories or your carbs, here's what you should be doing. I mean, once it starts to really sense your exercise, your diet habits, your health habits, how you're feeling today, your schedule, et cetera, it can really provide a customized kind of recommendation for you. And the more that we can personalize that for consumers, I think the more successful we'll be.
Well, and that's ultimately, and this kind of field is sometimes referred to as quantified self. And as your quantified self abilities extend beyond your run tracking, or meal eating, and start to communicate with your doctor, and they can see when it's time to, change your medicine or change some kind of, now I'm completely out of my depth. I'll just stop right there. When they start to communicate with your doctor, that's going to be really powerful.
I think that government can learn so much from what some of our clients are doing in the private sector with respect to understanding better what their users, what their customers want from them. Right. What are the different touch points along what we call a customer journey from researching a problem? By the way, this is what we're all here for. We all solve problems through this, right? A consumer has a problem, they research it, they look at the alternatives, they make a decision, and then they buy or whatever, and then that kind of starts over because that plays into their researching in the next problem that they have. This is sort of what Galen was talking about earlier on one of his slides. But what the private sector is doing is trying to understand along that customer journey, what can I do to help you? And where do I need to do that? Is it in the web? Is it on mobile? Is it in social? Is it through a combination of digital campaigns with traditional media campaigns so that I'm pushing and pulling you into the right directions to get to the right information? And then how do you want to consume that information? Now, this is really important. A couple of years ago, and Dan, I know you could talk a lot to this, but going from web to mobile, what the private sector did first was just simply mobile enable their website. Okay, so you guys have seen a bunch of government sites, right? You get a government site with a ton of information on it, and you can't find what you're looking for, and somehow you're going to do it on a phone, right? It just doesn't make any sense, right? So the idea is, what can you do and what will you do on a website, and what can you do and what will you do on a phone? And then when will you do it, right? So when can we give you that information so that it's the most powerful for you? And I think the private sector is making huge advancements in creating content and serving it up in different channels, but working together when they do that, right? Because it used to be everybody worked in these silos, but they're realizing you can't work in these silos because you want that customer journey to be flawless and consistent, so that experience with the brain is good. The government sector should be doing the exact same thing.
So, let me add something else on the notion of silos and trying to bridge those silos. So something else that government can do, and as you consult with public sector clients, think about this, is that government can actually invest in some of the high-risk research that you guys can later take advantage of. So one example, of course, is the internet itself. And I remember when the NSF, Larry Brandt, gave money to Mark Andreessen and say, hey, we need a browser, what say? And that kind of generated some good movement. Yep. Another example of that more recently is the Department of Energy was trying to figure out how to get messages out to people to control their thermostats. That led to the Nest that many of us have, and you can get down at Emporium right now. There are a number of those that we can do in medicine, and we can do in every one of our areas. We can do the high-risk stuff, but then we need someone else to pick it up and take it to the next level. We can then study that in context and build it to one step beyond.
And if can I just one real quick? Yeah, and it is that high risk, big picture research that is going to help solve some of the problems. Just real quick, one of the problems that we see in the private sector, as Kevin said, we used to push cram websites into the mobile phone. Then everybody got really excited about apps. But there's an inherent problem there, and if you look at it from the point of view of a grocery store like Kroger, you can't have, every brand can't have an app. And this just doesn't work. And then how are they going to all aggregate up into a Kroger app or a Whole Foods app or a Publix app? Similarly, probably every one of you guys out here can't have an app for every one of your projects. So you've got to figure out where the big picture aggregate is that may be led by some really big thinking, risk-taking that says, we're going to aggregate all of these things under this umbrella, and you can all play there. And we're not making apps anymore. You get cards of information that slide into the new kind of way that this is going to work. But that's I think, a problem that we see in the private sector and that you guys probably have as well.
Agreed. Let's just go build an app. That'll fix the problem, right? It's a terrible idea. So I would ask you, Brad, so how are those decisions made that we're going to go out and do research in these kind of higher, more strategic type of initiatives?
So some of that is set by the President's Council of Advisors in Science and Technology and Envisioning a Digital Future. And so we have the best minds from MIT and around the country to do it. That's one way to do it. But what's more interesting and more productive, I think, is to have these sorts of panels, actually. And we do a lot of that. Yep. So we'll have these workshops, we'll have DC to VC, right? So we have venture capitalists and DC sitting in the same room saying, let's talk together about the problems that you're finding. Figure out, in our case, it's health. So what happens in health? How do we get the supply chain problem solved in health for behavior continuity? And then you guys say, well, I did this and this, but man, we can't invest in that bigger area over here. Then we say, aha, that's the one we have to get at. Okay. So that's a good question.
Oh, really? This is fantastic. Anybody else need to add? Can we move on? Each of these subjects, it's frustrating because we really could spend a panel, I think, in all of these areas. But let me ask that kind of third bucket. Let me get to the third bucket, which is the important considerations for health in this arena. As the people in this room know, there are really critical issues of privacy and protection of human subjects that we have to deal with in health that others don't have to deal with in the same way, necessarily. And there is no question that HIPAA regulations and IRB standards must be not only followed but honored. Yet from a strictly narrow point of view of digital communication, they seem to put some tremendous restrictions on what we can do. And how we can actually make the connection between digital and behavior. So let me ask the first question, which is, how is the private sector protecting the privacy of clients in what you're doing?
Yeah, why don't you go ahead? You're the big daddy there.
I mean, this is a really tough one. I've said that before. I think that as a society, we've we've decided that health information is more sensitive than other types of information, right? So what that means is that it's harder for us to use. It's harder to use for good benefit, to help people, to understand user insights, to understand what's working really well, and ultimately add value. I think that what companies need to do is make sure that they're being very transparent about how they'd like to use the data, offer users control, and I think Google tries to do this a lot with our users and our products, is offer users control. Privacy doesn't mean one thing. Privacy means a ton of different things, and it depends on who you're asking and what context. If you ask a teenager what privacy means, it's very different than asking somebody who's 65 years old, right? We all have different, different needs of privacy and different levels of comfort. So giving users the control to decide how they want their data to be shared is really important. And then probably the most important thing, I think, is around security, right? You can't have privacy if you don't have security, and so the most important thing is for the companies that have this data to invest heavily in securing it and take it very, very seriously to earn and to maintain that user trust. So I think that's what the successful companies who are doing this and who will continue to do this in the future are going to be focused on.
Yeah, I think I agree with that, Roy. I think that, so your one statement of society looks at health behavior as a little bit different, I agree with today. I agree with that today. But I'll say this, in 2002, Bank of America tasked my company with trying to figure out how do you get people to pay their bills online. Is there anyone in here that doesn't pay a bill online? Good for you. I'll let Bank of America know. Just so the thought of it back then, right? Just absolutely ludicrous. And we did some really large ethnographic studies, sitting in people's homes and watching them take mail and put it on a counter and then take it to the kitchen table and pull out checkbooks and grab their husband and argue about bills. And we did this for, 3 or 4 weeks and all over the country. And what we learned, I'm not going to tell you everything we learned, but this is really, really important. One of the things that came out of that was if you can build something for them that makes their life easier, they will give up information. They will not hold it to the vest as is important, because what they're trading off to hold it, they're giving up, right, if they would give it. So I'm going to give you the one example that came out of this research was over and over and over, we heard people sitting at the kitchen table negotiating which bills are they going to pay because they haven't got their next paycheck. They're living paycheck to paycheck, right? And we thought, what if we could allow people to figure out what is the absolute last minute I can pay this bill and still not get a late fee? And that's what Bill Pay does, by the way. One of the true things that Bill Pay does, look at it, first thing you click on, it'll tell you when will this check arrive. So there's 2 parts to that. When's the last day I can pay it? And the second, the assurance that it actually arrives so I don't get the late fee. We put that into the Bill Pay features and adoption skyrocketed, literally like that. People were going to this specifically for a bill or 2 bills to see if they could work the system. And then they found that they could, and guess what? Social Security number went right in. So over time, I think, and we're going to talk about this a little bit in a second, but over time people get desensitized. Totally. But they get desensitized for multiple reasons. One of those reasons is just a trade-off in what you're providing or allowing them to do that makes their life better. And I think that's hugely relevant to the public health sector.
So what are the limits of what can be done in public sector health? What are the limits that can be of applying any of this? What are the limits for us? Many of us in this room are in the health communication field in one way or another. And let me ask this also with a kind of twin question. What are the changes ahead in the government's ability to, or its openness to gathering evidence online under what standards of security and privacy? Are there changes on the horizon at all? Is there any hope? And I don't know how much I'm hoping for because there's that ick factor too. So where's the balance?
So let me speak for the public sector a little bit. And I just got a tweet from Edward Snowden. So privacy still becomes a ping pong ball. But something that you folks mentioned that helps us think about the problem, we have to think about the problem in more sophisticated ways, is to distinguish between confidentiality/trust and security, right? So security is often a technological solution where I remember there was a lot of discussion about e-commerce in the 1990s. And someone said no one's ever going to put their credit card online, and people have been doing that, kind of like your story. So we can secure that, but what's more important on the confidentiality side is that the public, as the public says, I will participate, let's say, in a social contract on research, and I sign a form, or there are other ways of doing this, to say that I'm going to donate my data to you. I want to be sure you're using the data exactly as I wanted you to use it. And I don't want any surprises. That's the Edward Snowden effect, right? Now, why this is complicated is because if anyone here works in health, I'll say the words HIPAA, and you'll all have these like, oof, kind of feelings right away, like I can't do research ever again in my life. The other side of HIPAA is that, so that's the Health Insurance Portability and Accountability Act. The other side of HIPAA is that if a patient demands their data from their doc, you got to give it to them. Right. No one ever thought that before. This is a new world. You know, you didn't have your data. You don't own the data. What are you talking about? This is my data. I'm Kaiser. But actually, HIPAA says, no, you need to give that to the patient. So it's more control to the patient, more evolution of the social contract, paying attention to confidentiality, trust, and predictability, and then security on the other side.
For us, Julia, since we do a lot of behavioral research to map what people are doing offline to the digital world, a lot of ethnographic qualitative research, I would love to get rid of OMB. So if anybody's got influence for an executive order, let's do that tomorrow. It's just ridiculous to me that we can't talk to people and ask them what. I know that's complicated, but that right there is such a big hurdle, has been a big hurdle for us since we started doing business in the government sector.
So, so I can't believe I'm going to be an apologist for OMB, because I've never been that in my life.
I want to hear it.
But it brings up a very interesting controversy. So on the one hand, yes, take all tethers off. Let me just do what I think is right according to my conscience, and I'll talk to whom I want to, and people want to talk to me. That sounds great. We don't need RB in the private sector. And then you hear about the Facebook experiment a couple of months, or about a month or two ago, right? And everyone, talk about an ick factor. I mean, a lot of people said, you were doing what to me? Well, in fact, we do that all the time. The Google experiments you were talking about are similar to that. They're natural experiments where you try one ad, see what kind of traffic we'll get, and try another ad. So I think the private sector is going to be dragged in, unfortunately, to this conversation, and so we need a new version of OMB, I think.
Yeah, I agree with that. That's a really good point. I would love to get Roy's perspective on this. One of the things we're trying to do in our behavioral research is look across projects, both private and public, to leverage the information that we find out about people. You'd be amazed at how similar we all are. Everybody in this room thinks I'm very unique, but when you boil it down, we all consume information and make decisions in very similar ways. And you can use that, right? You can use that from one context to another. It's when you move from purchasing a cell phone to making a reservation to fly up here to DC, to choosing a doctor, the type of person you are and the way that you go look for information or referrals or whatever, however it is that you make decisions is similar to other people. And so what we're trying to do is take that information and say, okay, if we know this about people and we now have a new context that's in the public health sector, can we extrapolate these behaviors over here and start to test some of these different digital products, start to look at big data platforms and see if we can create an optimal solution based on our current knowledge so that we don't have to go out and recreate the wheel and talk to new people. So I guess my question back to Roy, it's a long way of asking you, when you look at digital footprints, right, and you look at how somebody, I equate digital footprints, how somebody searches and moves around the internet to who they are behaviorally offline. This is the type of person I am, types of information I need, so I probably search and consume very similar types of information. Can you take big data digital footprints and extrapolate that from one context, buying phones, to another context, public health sector?
I mean, I think that you can. Well, first I'd say this. I think that companies like Google aren't interested in what an individual user does. That's not really interesting. What's interesting is what statistically significant number of people do that can help understand trends and insights to really have impact, right? As you say, so, I mean, we're all not that unique. And so when you start to look and understand how different groups of people consume information or make decisions, that's when you can really have an impact. And I would also definitely agree with you on the piece of adding value to users. The entire internet is and I mean, all the content you have online for the most part is free, and it's free because it's supported with advertising, and that is already an implicit trade-off that users make. The content they get is valuable. I think more and more so we're seeing that the ads that users see are valuable and relevant to them, and so that trade-off is something that people are comfortable with. Right. Can you make comparisons between what we understand about people online? Can you extrapolate that offline? I think absolutely so. If you think about a user, users don't distinguish between online and offline. We do because we're marketers, so we think about our digital strategy and our mobile strategy and our social one, but users don't. You wake up in the morning, you check your phone. Mine is on the bedside table and within arm's reach. It's the first thing I look at. And then the TV's on while I'm getting ready. Then I get on the bus and I'm checking my phone. I get to work. I'm online. The TV's on in the background. I mean, you're constantly engaging with media. There's billboards and subway messages, and so I don't think about it as online, offline. I think about I engage with media wherever I go, and I make decisions based on the information that I get and what I see and what I think and what I hear online and through my friends when we get together. So I think that those insights that we can pull from online, and you can pull a lot online in an aggregate form that's anonymous, that's anonymized, and doesn't include any kind of personally identifiable information, those can be really insightful to help campaigns be more effective, to be more efficient with tax dollars, and actually make an impact.
It hurts me. Does anyone, Daniel, do you want to say something? No, it hurts me to cut this off. I'm sure it's hurting some of you too. But in the interest of having a conversation with the audience, I want to ask one brief question and ask you to give brief answers if you care to. What are the radical new ideas and possibilities that are on the horizon in this whole arena? Is there anything out there that you'd like to disclose that you're seeing that we don't know about?
Well, I'll take one because I think it segues nicely from Roy's comment, and it's another plug for Google. The blurring of the line between offline and online is well underway and is going to speed up radically. Especially as we start thinking about not interacting with the data through a screen or a little rectangle. And of course, I'm talking about Google Glass and other things like it, where we start to have augmented reality influence what we're doing as we're walking down the street. So it might be Kevin's going to get his Dasani Kevin, or I'm going to go in and get some information about how to stop smoking, right? And I'm walking down the street and it's around me all the time. I think that those kinds of things are going to just further enable, if you want to look at it in a positive light, our ability to communicate and connect and influence behaviors in a positive way.
And I think one of the keys to that is that technology now is a learning system. It's not just a way to deliver something. It learns the more you use it. And so years ago, we spent AT&T spent a lot of money with us trying to figure out how to get people to customize a website. And if you ask anybody in this room, hey, would you like a customized experience? Every one of you say, of course I would. But most of you
nobody would do it.
You're not going to do it. You're not going to spend the time to do it. What you want is a brand to understand who you are and the types of things that you want and when you want them. And you expect that to be served up in an intelligent way and not an annoying way and not a creepy, they're watching me kind of way. So there's a nice balance there. But I think brands are doing a great job of starting to learn and build those profiles so that they can create these programs, to Roy's point, that are not sent out to Kevin, and they're not sent out to Daniel. They're sent out to the masses. It's just that Kevin and Daniel are very much alike, so we get the same kinds of things at the same time.
So, I was going to, it's funny you mentioned the learning piece, because there was an article that came out in the Wall Street Journal last week, and it pointed to me what I think is next biggest on the horizon. So I used to do research in artificial intelligence, and I expected to have flying cars and robots, right? And I didn't quite get that. But what I did get is I get embedded intelligences around me, and every time I go online with Google, because it's an incredibly informed search algorithm that I use on Google. What's that?
Siri wants to join the conversation.
Talking to you.
Nice.
Someone from your past has showed up.
Siri, I miss you. Was that really Scarlett Johansson? I'm not sure. So it's there. We talked about Nest. So what's different is that we've taken AI and we said we don't want machines to act like us, really. What we want are machines that help us be the best we can be, and we need smart machines to do that. We need machines to do some intelligent things. And now, and here's the important piece that Siri can help us out with, is that we're going to connect it with neural inputs from billions of people around the planet. Yeah. And that's going to make learning go up exponentially. Right. And the way we used to do public health campaigns and evaluate them, that's out the window. Right. We got to do this like overnight, right? I mean, this is what we do with 23andMe. They did that and scared us all, but they were doing a very good job at it.
Well, how's that for a mind-blowing? Go ahead, Daniel.
Okay, so since you gave me the opening, I'm going to take it. The big thing, I think, that the risk part is instead of me paying 23andMe to sequence my DNA and then decide to use it for various things, if they paid me to sequence my DNA, and then for every study that I got my DNA involved in and helped something, I got paid for it. Monetizing my own health data.
It may not be a bad thing, right?
It would be an incentive.
Yes, fascinating idea.
Oh, my goodness.
You open it up.
Oh, my goodness.
Thank you.
Well, now we're going to open up to you all and ask you to join in. Is Amelia Burke Garcia here? I know she was on the list. I wanted to acknowledge her contribution to these fields. Are you down there? Thank you. I wanted to acknowledge your contribution. There are some microphones in the back. Tiffany and Dina are going to bring them to you. What would you like to say? Just keep it short and to the point so we can talk to as many of you as possible. Okay, to this lady here in the black jacket.
Lady in a black jacket. There's a lot of those. Hi, my name.
Would you mind, giving your name and the organization that you're?
Hi, my name is Nina Bhattacharya, and I'm with Academy Health, which is a health services research organization. So I work with a lot of informatics folks, and when talking about health communications or anything that deals with social media, data validity comes up so much. How do you validate that data? Like, is it the methodology, is it accurate? And oftentimes when fielding those questions, I really don't know what to say, so maybe I wanted to throw that out to you guys. Data validity, how do you answer that when researchers are asking that question?
One way to kind of jump into it, and I'll turn to you guys too, is that part of what we have to do is really change the dialogue in thinking about what validity means. And this is what I mean by this. Whenever we used to do surveys, we used to think about response rates. And then Don Dillman says, no, look, it's really about coverage and sampling, and there's just a lot of other things here as well. Don't use that little teeny piece. Well, that's what's happening here. What happens when you now drive in up so broadly that you start washing out through normal distributions of noise some of the invalid data? So some of the big experiments in crowdsourcing has been what happens when you pump a lot of in, right? Under certain circumstances, you can start approximating what really happens in invalid ways. That only happens in some time zone. So the problem is when this stuff enters in and looks anecdotal rather than large N based, then I think we start getting into the same problems that we have in inferential statistics. But the great thing is that we've got a lot of mathematical minds now that are helping us think about it, and it's a new conversation in big data about what constitutes reliability and validity. That's the way I look at it. It may not be valid, though.
Would anyone else like to tackle that, or anyone in the audience would like to tackle that? You stumped us. Who else would like to speak? Okay.
Hi, I'm Joseph Jefferson. I'm with ViiV Healthcare. We're an HIV-focused pharmaceutical company. And I'm thinking about the problem that I think many of us contend with, which is, how to engage with consumers who could be defined as having low levels of health literacy. And these are consumers that typically aren't as savvy and are not engaging with digital platforms to the extent that we are wishing that they would. And so I wonder if any of you have some comments on how you would develop or how you think digital platforms can be shaped and messages can be shaped, strategies can be shaped in order to better engage in an interactive discourse with those particular consumers.
So go ahead, Roy.
Please.
Go ahead, really.
Okay, so I'll speak briefly on what I think that Google can contribute to that. I don't know that most of them or many of them are not online. I just think that you do have to take care to make sure you're speaking their language so that you're providing information that's actually valuable to them. And I've noticed just in my work with CDC over the last few years that there are many efforts underway to use plain language that actually relates to the users. From a Google perspective, what I think that we can do, again going back to search data, is use search data to actually understand how consumers are phrasing the questions and the symptoms and the fears and the whatever is on their mind, how they're phrasing it in their own words. And oftentimes that's what we do when we work with the government. So I'll give you an example. Working with the healthcare exchange campaigns, during open enrollment last year, one of the searches, the terms that kept coming up was Obamacare. And I think that early on, early days, Obamacare didn't have very positive connotations, so it might not be one that you want to proactively, associate with the campaign. But if you start to see that the users who might be seeking, health insurance online are searching for Obamacare or for other similar terms, you have to really be quick and flexible and adapt your communication strategy to, the questions that your audience is using. So from a Google perspective, I think that we can help with the data insights, with the search, to understand how different segments are actually asking those questions.
That's good. I might just add that User Insight created our own social media personas, behavioral archetypes about how people interact in social media and why do they do it. And I would say this. I would say that back to the other lady's question before about data validity. You see an influencer score out there, and a lot of these platforms that'll tell you that your message had a high influence because it was echoed so well. And I might say that that's maybe not true, that maybe what happened is one of our personas that we call Chatty Cathy has caught that message, and she's blowing up everybody's Facebook and Twitter account, right, because she can't stop talking online. And because she can't stop talking online, it looks like that spike has influence, when in reality, I see Chatty Cathy come on and I do not look at anything she says, right? But the opposite of this is also true. There's a persona or behavioral type out there that doesn't speak very much in social media. They're voyeurs, if you will. They're watching and taking in information, and they're also huge influencers in your lives, personal lives, face-to-face kind of interaction. And so my suggestion to you would be to seek out how can you create a campaign or content that these people would read or consume and turn around and say, Brad, I got something that you should know about, right? And you use the influence of the medium, you use the power of the medium, I guess, to use the influence of the person to do it face-to-face. Now, the problem is you'll never, well, I shouldn't say never. Today, you can't measure that. You won't be able to measure that because he's not going to say anything about consuming the message, and you're not going to know that Brad and I talked about the message. But I think that is one way to start to try to create, campaigns to see if maybe you can take really, really focused and really good content and get it just to kind of seep out into the communities.
Just one quick addendum to that. Especially considering who your audience may or may not be pre or post exposure, a solid social strategy does not equal a Facebook page, right? And so your most effective channel might be Grindr or Tinder, right? And that's just something that I don't see very many people talking about, is that there's more to social than Facebook.
Excellent. Let's take a question from over on this side.
She had her hand up for a while.
Yes.
There's a couple.
All right, thank you.
Hi, my name is Lisa Fager. I'm from the Congressional Black Caucus Foundation, and I actually oversee their HIV/AIDS campaign. So I really appreciate his comment from Vive, and I want to play off of that. And prior to doing being a consultant with civil rights organizations, I worked for the Discovery Channel, and so I focused in marketing for 10 years there with one of the biggest brands. So one of the questions around health literacy and the most, I would say, at-risk population around HIV/AIDS is that they're probably, the same audience that's highly digital, particularly in the mobile realm. So we know that they use mobile media more, utilize more things in mobile media than any other populations. Both the Black and Latino populations use more. So what are some examples? Because I feel like we don't target the specific content. When you talk about content, we're not talking about blogs and writing. We're probably talking more visual, because this is who we're trying to reach. And so do you have any examples of successful campaigns having been funded through the CDC? I feel like the campaigns that they're funding for those particular audiences are mostly flat, picture, they don't talk to you. And so I just don't think, and I think that although we can't measure the digital success, we could measure the outcome of, rates maybe going down or something. So.
Yeah, so there's, that's a great question. So there's a lot of examples out there of, I really believe the government can do a lot, to your point, to create engaging content, right? It is flat, it is boring, it reads like a textbook, and we hear that over and over and over. At the same time, especially with CDC research that we've done, across the board, 100%, I've been doing this for 7 years with users out there, and they trust it, right? So now we have to take that trust factor and create something that's engaging, because they will use it and engage in it if it's kind of fun. So there's a couple, you look this up on YouTube, but when I see examples like this, I just think that, if somehow the government could create these kind of thing in the healthcare or in the health sector, it'd be amazing. But there's one, go to YouTube and search Dollar Shave Club and watch this video. This guy's got 17 million views. And this guy took the concept of a razor, which you can't get any more boring than that. And he's totally turned the razor industry upside down with one video. And it's a really fun video. And it's just not just for men. I just think it's people who like that kind of content. So look at that one. Also, Google the Chipotle Back to the Start campaign. This is an interesting campaign Chipotle did a couple years ago. They wanted to use, and so one way I think to do this is you can use the power of social media to test your messages before you actually go live with a national campaign. Yeah. Put it out there, see if people like it, or are people engaging in it, tweak it a little bit, right? And play with it a little bit. That's what Chipotle did. And all of a sudden they had this great story, and you gotta watch the story, because it's actually, it might bring a tear to you. It did for me. So what they did was they tweaked it, and all of a sudden they started getting this huge influx of people looking at it. So they thought, well, we're not going to go big media yet, but let's go a little bit step further and see what happens. So what they did was they bought some media spots at theaters before the little commercial that comes on before the movie starts, and literally had people in the theater clapping and cheering, and they're like, we got something here. So they bought one commercial, 2011, 2012, don't quote me, and I think it was with the Grammys. And they ran a portion of this, and then pointed people to YouTube to find the rest of the story, and it just went viral. I mean, just nuts viral. Next 12 months, revenue increased 24% in Chipotle stores in an industry that would love a 1% to 3% increase in any given year. So, but it was engaging, right? And it was something that that spoke to a particular audience. And I think you got to do that, right, in this sector. And if you do it in a way that's compelling, people will share it.
I have a bunch of examples that I could share with you. The Ministry of Health in Canada has a campaign to tackle social smoking. Lots of folks are like, I'm not a smoker, I just smoke at parties or at bars, and it's called social farting. And it's tongue-in-cheek and catches your attention. Go to YouTube, Google it, search it. It's incredibly amusing, and it started as a TV PSA, and they caught on that it was really effective, and they put it online, and it's been shared like crazy. One more, NHTSA has done a ton of really great collaborations recently on YouTube with influencers. So they have a campaign against texting and driving. It's called Textbert, as in I'm an expert, I'm a textbert. Search for it online. It's a rap video, against texting and driving. It's comedic. It's been watched over 6 million times by young men, the exact demographic they're trying to reach. So very effective, very engaging. And lastly, I'd say that CDC's Act Against AIDS team has actually been doing some, I think, really groundbreaking work that sets them apart from many other government groups. It's worth taking a look at the Start Talking, Stop HIV campaign. Well, so I think Act Against AIDS they've got a series of campaigns, so many different audiences they're trying to reach. Specifically, you asked about doing, being on platforms where this audience over-indexes, like mobile, right? And that's what I was alluding to earlier when the gentleman mentioned that, maybe these audiences aren't online. I think that many of them are. They just might not be on Facebook, or they might not be searching, or, I don't know where they are, and the research can tell us that. But one of the Act Against AIDS campaigns was called Start Talking, Stop HIV. And they knew that their audience spent a lot of time on mobile. That was actually with AIR. And so what they did was they essentially created a kind of a mobile experience for these guys to find conversation starters. So you're nodding, you're probably familiar with it, right? And I think that's a great example of taking these little snippets, these conversation starters, and putting them in the hands of these young men who need them wherever they are. So if these guys are at a bar or at the bus stop or wherever they are, and they're meeting someone who they just met online or someone they just started dating, they have these conversation starters that can help them have these conversations around safe sex, HIV, etc. So I think that's a really good example of meeting these guys where they spend time.
Just one real quick. To Kevin's point about testing messaging, we were working some with the CDC, and we did 2 campaigns, one about no BRCA, about the BRCA gene mutation, and then another against intentional tanning called The Burning Truth. And they were images, they were mainly on Pinterest and Instagram. They were very targeted. We did it was a 4-week campaign. We came up with it in about 2 weeks, and we put it out in 4 weeks, and we had the Burning Truth hashtag, which still gets used. But that was messaging that happened fast. It happened very quickly. We didn't think about it. We did our best to overthink it, but we managed not to, and we got it in market. And I think that using the social channel to create rapid turnaround messaging and just test it, because you're going to find something that works, and then you pull that out and you make a bigger push around it. I think that would be a very effective strategy.
Thank you. Tiffany, can we get somebody from over here?
Is it on? Okay, hi. I'm Bernan Deal with JPA Health Communications, and we support a lot of nonprofit organizations working in specific disease areas. And this is a great conversation. I think a lot of the conversation is rooted in very big health campaigns. What are the best practices? What's your sense? What's your counsel on how to scale it when resources are tight and an organization is running off of donor dollars? How do they concept the campaign and then go out there and lay enough breadcrumbs so that they can meaningfully understand what's working and what's not? I know what we're doing, but I'd love to hear your thoughts.
And we have 3 minutes just to let everybody know, so we can do a quick answer, one more question, and that's the end.
I'll do a quick answer. It's pretty easy to use Pinterest and Instagram and create images and then push them to a direction and then track it with the lovely Google Analytics, free analytics tool. So you need to move fast in free environments and then track your results.
Thank you. Okay, Dina?
Because time is short, I will just focus on one question, and it is on behalf of my students. Just now, I'm teaching at George Mason University a class in health behavior theories, and I would like to know from this panel, where can I direct my students to go and look for actual outcomes or impact data?
Where can you direct them to find like case studies and outcome data from campaigns? I mean, yeah.
I want to point them to go somewhere and get all these.
From Google, I would just say do a search for Think with Google or Think with Google Government, and you'll actually find a website dedicated to all sorts of case studies and insights that we've pulled from our work with the government space.
You can also go to PubMed, and the American Public Health Association published a good review of outcome data on social media. Lead author is Cho, C-H-O-U.
Great, great. Folks, okay, one last question. This gentleman in the back.
Hi, I'm Steve Merton from WebMD. I'm from the Government Services Division. So we do a lot of work with federal agencies. And just scanning the room, there's a tremendous audience here as well. I can see many folks from government agencies that we work with. You know, Eric Topol just published a book called The Patient Will See You Now, which is a terrific treatise on the fact that the patient is now in charge because all of these wearable devices and so on are loading up people with so much information and obviously WebMD is very much part of that whole process. So is it possible to conduct evaluation, and is it making a difference? Absolutely. I think the whole pharma DTC work has proven that. All of these late night ask your doctor kind of ads are driving people to ask their doctor for particular medicine and so on. And like the old treatise of social marketing is how can we adopt some of these methods to really drive people to get screened and so on. You know, at WebMD we've got something like 64 million people that are highly engaged in looking after their health. So how can you use platforms like this? I think one of the problems we see in government is that a lot of work is in silos. There are a bazillion different campaigns, a bazillion, I think you brought up this issue, each with their own tactics, each with their own tools, each with their own websites. And does that really make sense? Government is great at research, it's great at content, but you know, it has a ways to go in terms of dissemination. So how can we use some of these platforms? How absolutely data is important. The streams and streams of data that we look at every day to make sure that we're continually attracting an audience. So there are ways. It is expensive. We do our internal studies. We did a study on work we did for AHRQ on their effective healthcare work. And we did find that, you know, it was indeed effective. People were raising some of these topics with their doctors. So it can be done. There's just smarter ways of going about it.
And I'd like that you end this by asking a question of not only the panel, but of the audience. How do we do this? And I'd like to say that this conversation has to continue. Obviously, there are many, many people interested in this. We at AIR will do our part. I look at my friends and colleagues in government and those of us who work for government and say, what are we going to do about this? How are we going to continue this conversation in an aggressive and really interesting way and make some progress? So I ask you that question last, and I want to, before we leave, I want to thank my colleagues at AIR who work with me very closely on the behavior change in a digital environment area. Would you please stand, folks, so that we can thank you? I can thank you. And so you're being shy. All right. Thank you. Thank you. And I want to thank the AIR Communications, Kathy Currier, the Vice President, Diana Huynh, who really ran this event for us, and other AIR staff. Thank you so much for videotaping and all. This will be online. Next one will be live. Thank you so much for coming, and some conversation can continue now informally. Thank you.